New information has come to light about how operating heavy artillery can cause traumatic brain injury among service members. In 2016, the U.S. military launched an offensive against ISIS that relied on the intensive use of artillery in order to minimize the number of troops needed. Though this approach appears to have achieved its goal, it had an unexpected impact on the artillery units. Last year, an investigation by the New York Times found that an unusually high number of veterans from these units are now contending with unforeseen health issues. These issues include conditions like insomnia, chronic confusion, memory loss, and severe anxiety. These symptoms are not recognized as service-connected because of a flaw in the military health screening process. Specifically, when military guidelines indicate that it's safe to fire these guns, the guidelines do not anticipate artillery operations as intense as those conducted during the ISIS campaign. The current screenings for traumatic brain injuries focus on identifying the impacts of singular large explosions like IEDs. They do not look for subtle signs of cumulative damage caused by intense artillery operations. So as a result of this gap in the screening process, many veterans have never received a diagnosis or treatment. We're also finding that some of these veterans have received misdiagnoses of attention deficit disorder, depression, or post-traumatic stress disorder. And this has led in turn to an ineffective or even harmful treatments like medication that did little to alleviate their symptoms. The consequence of these mistakes have been far-reaching. For example, there's been a noticeable increase in suicides among this group. But there are some reasons for hope. New medical research is improving tools for measuring the impact of blast exposure. We're seeing ways to prove that even small blasts can cause lasting microscopic damage to the brain if repeated over time. These injuries can be extremely difficult to detect with standard brain scans or blood tests right now, but this could change. The other question is how the military is going to protect active service members. In response to advocacy by veterans groups, Congress has tasked the Pentagon with developing new safety protocols. We've heard reports of programs intended to track and limit daily blast exposure. Unfortunately, many service members report not seeing these changes in practice. In short, the invisible wounds of artillery veterans represent an urgent and ongoing concern. We will continue to bring you the latest information and developments, so be sure to like this video so others can find it, and subscribe to our channel so you don't miss future updates. Take care.